welcome to this briefing on the INCB annual report for 2019 and also the precursors report. And I'm very happy to introduce President Cornelis de Jongeer and Barbara Remberg from the Secretariat of the International Narcotics Control Board. The President of the International Narcotics Control Board will be providing a briefing on the report, and Barbara will then be able to provide an overview of the precursors report. Of course, questions are most welcome from the journalists in the room after that. So with that, I'm going to hand over to you, Mr. President, for the briefing, please.
Thank you, Mr. Nezirki, for the introduction. Ladies and gentlemen, it's an honor to welcome you to the launch of the International Narcotics Control Board, the annual report for 2019, and the report on the Article 12 of the 1988 Convention, the so-called INCB Precursor Report. I also welcome those of you who are following this by the webcast. Just to remind us that the INCB is the independent, quasi-judicial body established under the United Nations International Drug Control Treaties to monitor their implementation by governments. In the next couple of minutes, I will highlight some aspects of the two reports, and then we look forward to your questions. The annual report has 4 chapters. Basically, the chapter 1 is about improving substance use, prevention and treatment for young people. The chapter 2 is about the functioning of the international drug control system. The chapter 2 is about the global issues, and we particularly wanted to highlight the issue on human rights and drug control. And chapter 4 is about a set of recommendations of the board. The main objective of the international drug control treaties is to ensure the health and welfare of humankind through ensuring adequate availability of narcotic drugs and psychotropic substances for medical use, while preventing their diversion to the non-medical use and that of the precursors to illicit drug manufacture. So let me move to the thematic chapter 1 of this year, which is about young people. So under the title Improving Substance Use and Prevention and Treatment Services for Young People, we draw attention to the use of psychoactive drugs among young people, and particularly in the age group of 15 to 24. And we draw attention to how to improve evidence-based prevention and treatment strategies for this age group. We underscore that promoting and protecting adolescent health will lead to overall greater public health and will also give great benefits to society. We have highlighted a number of actions that governments should take, such as establish mechanisms to improve the understanding of drug use and the factors that influence drug use, and improve disseminating knowledge of best practices on how to counter those. Secondly, establish a focal point for primary prevention, develop a national drug control strategy and a public health framework. Thirdly, build capacity for collaboration and working together with organizations and institutions to achieve prevention aims. Fourthly, improving national training for professionals. Fifth, providing evidence-based prevention interventions for children and adolescents. And 6, establish treatment and prevention services which go beyond school settings and includes a young person's family, communities, sports, and non-family arrangements. So from chapter 2, I would like to draw your attention to 3 particular areas. One is treaty compliance. The second one has to do with ensuring the availability of internationally controlled substances. And the third one is on human rights and drug control. In Chapter 2, we report on INCB's actions to ensure the implementation of the international drug control treaties. INCB stresses the importance of ensuring comprehensive implementation of the international drug conventions at the national level in order to strengthen the international drug control framework. The board remains concerned at the legislative developments in a small number of countries permitting the non-medical use of cannabis. In our report, we clearly state that these developments are contrary to the commitments those countries made with their contracting partners when agreeing to be bound by the drug control treaties. We are engaged in active dialogue with those countries in order to facilitate their return to meeting their treaty obligations. And we also express our concerns in the report about the possible consequences for health and well-being, in particularly for young people, of those policies. The annual report also draws attention to the global imbalance in availability and access of controlled medicines for medical use and the urgent need to address this gap. While the availability of controlled medicines has increased globally, the unequal distribution remains. Our report shows that almost 80% of the world's population, largely living in low and middle income countries, consumed only 13% of the total amount of morphine used for the management of pain and in palliative care. That is about 1% of the morphine manufactured globally. And this slide graphically shows that. We cooperate with governments to promote the adequate availability of medicines containing controlled substances for medical and scientific use. In Chapter 2, we also refer to INCB's ongoing close consultations with the government of Afghanistan under Article 14 bis of the 1961 Convention. Last month, the INCB met with the government of Afghanistan to explore how the United Nations agencies could provide further support to deal with the drug control challenges the country faces. We identified a number of areas, like the need for support to further support to agricultural and marketing opportunities for alternative livelihood programs, addressing the linkages between terrorism, insurgency, corruption, and drug trafficking, strengthening interdiction and investigation capacity of law enforcement to tackle drug-related offenses, including the trafficking in chemical precursors used in illicit drug production, the need for greater regional collaboration, and increasing treatment and rehabilitation services for those affected by drug use disorders, including women and youth. INCB is very much aware of the extraordinary challenges on peace and sustainable development faced by the government and the people of Afghanistan. And the board will continue working with the authorities to promote the engagement of UN organs and specialized agencies. The board stresses that efforts to stabilize the country will not be sustainable without effectively addressing the illicit drugs economy. The INCB Annual Report 2019 also emphasizes the obligation to respect human rights in the elaboration and implementation of drug control policy. Unfortunately, human rights violations continue to take place in some countries, purportedly in the name of drug control. The board categorically states that no country is exempt from human rights norms when implementing the drug control treaties, and drug control policies that protect human rights principles and standards have proved to be the most effective and sustainable. The board, in its report, we make a number of recommendations in relation to human rights and the drug control conventions. Among these, we stress that drug abuse and drug-related activities cannot be lawfully addressed without ensuring the protection of human rights and compliance with the international drug control conventions. In addressing drug-related criminality, states must continue to apply the principle of proportionality as a guiding principle in the determination and applying of criminal sanctions. And thirdly, while the treaties leave the determination of sanctions applicable to drug-related crime to the discretion of governments, INCB again urges states that retain capital punishment for drug-related offences to consider its abolition. The treaties required governments to give special attention to the possibility of applying alternative measures to conviction, punishment, incarceration for drug-related offences in appropriate cases and of a minor nature. And these include education, rehabilitation, social reintegration, as well as, when the offender is affected by a drug disorder, treatment and aftercare. In the Chapter 3, we draw attention to the global synthetic opioid crisis. It is estimated that some 53 people have abused opioids in the past year. In some high-income countries, such as Canada and the United States, synthetic opioids such as hydrocodone, oxycodone, and fentanyl are widely and readily available, and their aggressive marketing and subsequent overprescription has contributed to increases in dependency, overdose, and overdose death. The rate of drug overdose death in those countries has been steadily increasing since 2000. And globally, it is estimated that 66% of death attributed to drug use disorders were related to opioids. Increases in drug-related death are in part due to the emergence and abuse of illicitly manufactured fentanyl and fentanyl analogues in North America. INCB encourages the governments to work together with public health officials, pharmacists and physicians, manufacturers and distributors, consumer protection associations and law enforcement agencies to promote public education about the risks associated with prescription drugs and adopt appropriate measures to decrease their abuse and potential to cause dependence. And again, at this point in time, that epidemic is very much concentrated in North America, but I think it is our responsibility to ensure that it doesn't spread any further, and we have to make all efforts to contain that. In that respect, the Global Rapid Interdiction of Dangerous Substances, the GRIDS program, is an INCB global initiative aiming at reducing the trafficking in dangerous substances, focusing on new psychoactive substances, including the non-medical synthetic opioids, chemicals and equipment, and limiting their supply to consumer drug abuse markets. GRIDS has been designed in response to resolutions adopted by the UN General Assembly and by the Commission on Narcotic Drugs, asking the INCB to assist in efforts to address the challenges posed by these non-scheduled substances. The GRIDS program integrates and expands on a set of current INCB activities. That is the Project ION, IONIX, public and private partnerships that we've been developing over the last few years, and the Opioids Project. To close the annual report, I would like to highlight 3 recommendations from the Chapter 4. The Board urges all governments to develop national systems for the collection of data on drug use. We still see that those are, in many countries, we don't have those systems, they're absent, so we don't know really what the patterns are. Secondly, develop capacity building in the field of drug use prevention and treatment. And thirdly, implement evidence-based prevention programs for young people using a wide range of interventions in family, in school, and in their communities. Let me turn to the INCB report on Article 12 of the 1988 Convention. The INCB Precursors Report has established itself over the years as a reference for professionals and government authorities in the monitoring and analyzing of the latest trends in precursor control, and as a practical tool for addressing emerging challenges. The starting materials used in illicit drug manufacture are often chemicals that are not under international control, including purpose-made designer precursors with no known legitimate use. The pace at which these non-scheduled chemicals are emerging continues to be of our great concern. Since 2018, and just over a year after placing two precursors called NPP and ANPP under international control, these were two substances suitable for the illicit manufacture of fentanyl and a number of fentanyl analogues, traffickers have already begun to seek alternative precursor chemicals. And similarly, non-scheduled chemicals are used for more sophisticated and efficient illicit cocaine processing. Diversion at national level continues to be the main source of controlled precursors used in illicit cocaine production. And as alternatives to controlled drug precursors continue to be sought by traffickers, the substance-by-substance scheduling of under the 1988 Convention is a reactive rather than a proactive action. For the 29 precursors under international control, diversion from legitimate international trade has decreased due to the increased use by the governments of the INCB pre-export notification online, the PEN online system, and joint multi-country investigations have benefited from real-time information sharing through the INCB precursor incident communication system. This year, in the exercise of its mandate under the 88 Convention, INCB has also recommended the international control of methyl alpha-phenyl acetoacetate, MAPA, a precursor used for the illicit manufacture of amphetamine and methamphetamine. MAPA, again, has no known legitimate use beyond limited research and can be classified as a designer precursor. The Commission on Narcotic Drugs will decide next week upon the recommendation of the INCB. The precursor report makes a number of recommendations, and among them the board calls on the international community to engage in a global policy discussion to tackle the emergence of the non-scheduled designer chemical precursors. And this will also be on the agenda for the CND next week. We also call on governments to explore practical approaches to addressing challenges of collecting evidence to proving intent and knowledge in precursor-related crime. We call on governments to improve reporting to the INCB, including by providing details on the circumstances of seizures, suspected origin, and methods of diversion. And finally, we call on governments to take actions to implement the Article 13 of the 1988 Convention in preventing and investigating the diversion of essential equipment, such as tableting machines and laboratory equipment used for illicit drug manufacture. So with this, I conclude my short statement and presentation of the annual report and the precursor report, and I look forward to your questions. Thank you very much.
Thank you very much, Mr. President. So, the floor is open for questions you may have. Please, I believe we have a microphone coming. Please, could you introduce yourself and say which media organization you work for? Thank you very much.
Thank you very much. I am not for any media organization. I'm the ambassador of Colombia, and I rather than a question, I have a small declaration to say about the report, if you allow me, Mr. President.
This is a press conference where we would like to hear questions from the media first of all. If there are statements to be made by member states, I think that they could be given to the INCB the Secretariat. So this is a
last year in this same event, we did an statement. I don't know why this year
So this is. I'm not saying that you should not. I'm simply trying to make sure that journalists, first of all, have the chance to ask questions.
Of course, I respect very much press liberty, press freedom, of course, but I think that the states also have something to say, and what we are going to say could be also interesting for the media.
Undoubtedly.
I am on your hands, and I will act as you decide, but please take into account that member states have the right to do so. Thank you very much.
Indeed, Ambassador, and do bear with me, as I would like to see whether, first of all, whether the journalists have questions, and if so, that they can put their questions, and then we will certainly turn to you with the greatest of respect.
So thank you. My name is Luis Lidón from the Spanish news INCB. In this year's report, as well as in last year, there are some criticism to cannabis medical program in some way. I would like if the President can elaborate about what he sees wrong in this kind of program, or what is bad managed in these programs.
Thanks. As indicated over in the report as well, over the last number of years, a small number of countries have been moving towards programs to legalize the use of cannabis for non-medical purposes. They have used a range of arguments to do that. For the board, and in our responsibility as a board, which is to monitor the implementation of the International Drug Control Conventions, that is our responsibility. And these programs are not in compliance. They violate particularly the Article 4 of the 61 Convention and the Article 3 of the 1988 Conventions. So we have called the attention of the international community to that. Again, it's not an obligation to the board. Countries that have signed up to the conventions, they have contracted obligations vis-à-vis each other. And therefore we have called the attention of the international community to that. We have indicated clearly that these programs are not in line with the International Drug Control Conventions. And we are, as with many other countries, we are engaged in a dialogue with countries on these programs. Next week there will be the Commission on Narcotic Drugs. As you probably know, there will be lots of discussions about recommendations on cannabis, but that is what we've been over the last year been discussing as a board, and what we have called attention to.
My question was specifically about the medical programs.
The medical programs, sorry if I misunderstood your question. Cannabis is in a large range of countries is used for medical purposes. That is a prerogative and is a decision of countries to make, that they can use substances for medical use. That is within the convention, as long as they comply with a series of specific conditions that the conventions put in that respect. That is appropriate controls on production of cannabis, a national cannabis agency, and so on and so forth. So the convention, particularly the 61, but also the 88 convention, puts a number of conditions to countries that, just as with other controlled substances for medical use, if countries comply with that, then those medical programs fall within the conventions.
Hello, my name is Albert Otti with DPA, German Press Agency. I have one follow-up and one question of my own. Concerning the medical programs, would you say that most of the countries that have these medical programs are following the rules and protocols established by the convention? My second question is, when I looked through the drug trade and trafficking trends, I saw that amphetamines came up very frequently. Would you say that this is one of the fastest growing drugs in terms of trafficking and production around the world, in terms of global spread?
Yeah. On countries with programs for medical cannabis, we have a lot of ongoing dialogues with countries. We have a range of countries that have been starting to implement these programs. We are in dialogue with them then particularly on the conditions with which they have to comply. Most countries are doing that well. There are, for some countries, that is work in progress, and that is, again, in our discussions with countries. We do that here through the permanent missions. We do it when the board undertakes missions to countries where we discuss with the national authorities the conditions under which these programs are being made. But in principle, again, we try to make sure that all countries that go into a national medical cannabis program, that they know what the rules and regulations under the conventions are, and we do our utmost, to ensure that countries comply with them. And of course, countries will do the utmost to do that. Under amphetamine and methamphetamine, always difficult to get precise figures on that, but yes, indeed, I think it is of great concern to the board what is happening not just in many of the Asian countries, but also the increasing illicit trafficking and use of methamphetamine, also in Latin and in North America, and also increasingly in Europe. So I think, and this appears to be a trend that has been fairly recent and with a rapid increase, and I think it is something that we have also called attention to in the annual report in the chapter 3 under some of the global issues, and it is something that we also, particularly with the precursor program, that we therefore we put a lot of emphasis on this, that the upsurge in not just in methamphetamine, but surely many more synthetic drugs to come is really rapidly changing the face of the international drug control problem, and therefore we're very keen to address these, to address this.
Okay. Thank you. Further questions? Please, Luis.
When you say that the board is worried about the effect of the legalization in some countries like Canada, you are saying that this legalization is increasing the consumption among young people? Because I think this is what the report is saying, but I would like to, if you could elaborate about that. And other point is that in some way, last year was more clear that the board criticized medical program in some countries because it was some kind of view, and it was a step before the recreational legalization of if it's not well managed, because it gives this view of that cannabis is not so bad, I mean, as it is.
The concern is that, again, I think that's probably everybody's concern. There are two things. Within the framework of the conventions clearly limit the use of cannabis and other substances to medical use. So the conventions do not allow these substances to be used for non-medical purposes. Now, what happens, and that is particularly those countries that are moving in that direction, as far as we can see, and what we have, what we read, and what is in our dialogue, obviously many countries are setting up programs to evaluate the effects of that. I think in that respect, the jury is still out. We will have to see how that works. But that doesn't take away anything from the fact that conventions as such say that the non-medical use of cannabis is in violation of the convention, irrespectively of the public health outcomes of it. So I think we should, they're of course important to know what the public health outcomes will be, but at this point in time we are dealing with also a legal and a political obligation of countries that have signed up to the treaties. So I think that is that's the important part at where we are now. And again, it doesn't take away anything from the fact that countries that are putting in place those programs will look at consequences in terms of public health. They will look to consequences in terms of limiting trafficking and reducing the illegal market. So those countries, as far as we can see, are putting in place a set of indicators which obviously are important to follow. Now, in terms of the, again, coming back to the medical programs and what we wrote in last year's report, again, if medical programs are not appropriately set up, and if they don't comply with a set of conditions that are being stipulated under the conventions, if there's not appropriate communication around these specific objectives and the use of medical cannabis, there are risks involved that it may lead to blurring the boundaries of medical and non-medical cannabis. So that was more the concern that was expressed. But as these are all, in many countries, these are new programs, again, you don't have the hard data yet to make those judgments, but it's more a pre-warning about risk that may be associated with those programs if they are not being appropriately set up and implemented.
Thank you. Further questions? Please, Albert.
One more on.
Sure, can you wait for the microphone, please? Thank you very much.
I have one more question on youth. You write that there's a strong link between use of tobacco and alcohol and drugs among youth, but you don't say there's a causal link, you just say there's a link, which suggests to me there's just a correlation. Aren't you overstating the link? Aren't you, my feeling is that you're suggesting there's a causal link, but statistically there is probably none. Is that, what's the situation there?
I don't know. I don't think we're overstating it. I think we've used as much as we could. We've used the evidence that is currently available on this, but at the same point in time, I think these are complicated issues to research. I think it may very well be that those linkages may play out differently in different parts of the world. Very often when we, and we've seen that with a number of the thematic chapters that we have, as soon as we start looking for information and evidence on these, we're very much limited to certain parts of the world where those investigations are ongoing and where these studies are being done. And this only covers a small part of the world population, and therefore we constantly, we are calling for better and more systematic data collection in many more parts of the world that will allow us to, to have better data for better policy making in that respect. So I very much, appreciate the limitations that we have. We look at the limited evidence that there is, but that is the best conclusions that we can take at this point in time.
Further questions? Please, Luis.
Yeah, thank you. And in the report you mentioned that you use data of Canada, that the first time cannabis consumer has doubled if you compare the time of the legalization of cannabis in Canada with the year before, the same. I would like to if you could elaborate about what you see that is so bad for young people in the case of legalization of cannabis. I don't know if it's that people has the feeling that it's not so harmful as it is, or because I mean in the report you use some data pointing in some direction that indicate that there is an increase in consumption among young people, but I don't see the whole argumentation as elaborate as it should be. And then I would like if you could elaborate somehow what you see so bad for young people, how it impacts the legalization in young people, these kind of policies.
Yeah. Well, I think we have to go a step back again, because you know, it's not the board that says that legalization of cannabis is bad for, you know, there is a legal obligation that countries have contracted together and vis-à-vis each other in signing up to the conventions. They have collectively, countries have decided that that there are limits and that there are a set of rules and agreements that they have made that limits the use of these substances to medical use. Within the conventions, countries have said, you, the board, you have to monitor whether we as countries are implementing those conventions. That is what we're saying as a board now. We are seeing that there are certain countries that are not complying with their obligations under the conventions. And we're calling the attention of the international community to that. That is independent from, you know, ultimately the public health or the individual health effects of those actions taking place, or whether it may negatively or positively affect the illegal market or trafficking or whatever. It is purely a call of the board to the international community that an obligation under the convention is not being followed by a set of member states. Again, those member states have clear arguments why they think they are doing this, and some of those countries, and in fact I think most of them, are putting in place monitoring programs themselves to see what the implications of that are. But that is, again, that is independent from the legal obligations that countries have contracted vis-à-vis each other. And so that is what we are, that is our role as a board, to, you know, to call the attention of the international community to that. I'm sure that the international community at the same time, considering, you know, the extent and the huge, you know, implications of the world drug problem, obviously will be interested in looking at all kind of different measures and law enforcement and ways of dealing with the world drug problem as we see it. Therefore, we've also presented, you know, some of the new programs that we are involved in, particularly with respect to the synthetic drugs, because we see that the nature of the world drug problem is changing. And that may also have, you know, we need to see whether the instruments that the conventions provide and the tools that the international community has available under the convention, whether those are fit for purpose to address these problems. But again, with relation to cannabis, it's clearly an issue of the board calling attention of the international community that that obligation is not being followed at the moment.
Albert, please.
Sorry, I feel I have to follow up on that question. I think the question was not so much why you are talking about honoring the obligations. I mean, we all know what the INCB is and does. The question was whether you have anything today to say as the INCB on potential health implications. Because the INCB is not composed, because the INCB is composed, at least some of your members are public health experts. If your only job was to monitor the treaty from a legal standpoint, there would be no need to have health experts on there. You just need international lawyers. So as you are also as your work has also a health aspect, the question is, do you have anything to say on the potential risks of cannabis legalization from a public health perspective?
Well, obviously we have, but the whole point is, again, that those countries that are moving or have moved towards programs to legalize the non-medical use of cannabis, to them this is also a policy measure for which they have a set of objectives and And part of those objectives is obviously to, together with a set of preventive and educational programs in line with that they hope to be able to contain or reduce the use of cannabis, but at the same time to reduce the illegal market of cannabis. Now, the countries that have moved in that direction, some of them, they have put in place a monitoring framework. So, at this point in time, but you know, it may be still too soon to judge what is happening, and whether those objectives that are, you know, are set forth in those policies, you know, whether they will be fulfilled. But you know, to come back to the public health indications again, the role of the board is specific in that respect. We are, if you look at the preamble and the objective of the conventions, where we talk about availability and access of controlled substances for medical use. So those countries that have medical programs for cannabis, where they make that decision, or where they have programs for other controlled substances, there it is important that those substances are actually available. Here we're talking about the non-medical use and the harmful effects of controlled substances. That's why they are controlled under the international conventions. They're because there's the fear, and in many cases there is the evidence that they can have harmful effects. Now, in the course of the years, obviously, harm of substances, there's always, you know, a benefit-risk ratio when you talk about substances. They may have medical effects, they may have beneficial effects, but they also may have harmful effects. And in the course of, as the evidence grows, that balance may also shift. But at this point in time, and why countries have decided, you know, to put these substances under international control, was particularly also because there are harmful effects. Now, as you know, the next week the Commission on Narcotic Drugs will be discussing the classification of cannabis, and that is one expression of countries and of state parties to have a re-look at whether the classification of cannabis is appropriate as it was made in 1961, because since 1961 we're almost 60 years further down the road, so medical evidence has evolved, and therefore that will be on the agenda based on the scientific evaluation by WHO.
Thank you very much. Please, Mr. President of the Correspondents Association.
Thank you very much. My name is Abdullah Sharif, and I'm representing Horn of Africa News Agency. In the report, as like in the previous years, Africa is being described as a transit area for the drugs. And in the report, in the 4 or 5 pages report regarding Africa, I noticed that the example of Kenya and the use of drugs among the pupils and young people could be also taken for Sudan and other countries. Last month I was in Sudan, and I noticed the increasing use of drugs among the students of the universities, chemical drugs, and also there is rumors that some people from the previous government in Sudan also involved in drugs. I don't know to which extent you have information regarding these accusations. Thank you.
Yeah. Thank you. I don't have, at least as far as I recall, I don't think that we have specific information in that respect, but we definitely share your concern. As I stated, I think it is very important that we, particularly also in Africa, that we get much better data drug use patterns, and because at this point in time, many countries don't really collect this in a very systematic and in a regular manner. It's also clear that, you know, over historically, where we had a rather, you know, clear distinction between drug-producing countries, drug transit countries, and drug use countries, I think those boundaries have clearly been blurring very much. That nowadays, with synthetic drugs, every country can be a drug-producing country. Drug transit countries also are drug user countries, and drug-producing countries are drug-using countries. So I think again, the whole nature of that problem has become much more general, and we definitely share your concern about the expanded the expansion of drug use also in countries in Africa. I think last year UNODC, together with EU funding, they made a large together with the Nigerian government, they made a large survey on drug use in Nigeria, with quite you know, concerning and worrisome outcomes of, you know, high prevalence of drug use as well. And I think it would be important that all countries actually engage in, you know, very systematic data collection on this, that will allow to get a better understanding, and then also will allow to design and implement national policies to try to contain this. So we share your concern. Yeah.
Okay, just checking for further questions. So please, Ambassador, the floor is yours.
Thank you very much. I decided to adapt myself to this format and not to present a formal statement about that, but to rephrase what concerns my delegation in two questions. The first one is the coca cultivation in Colombia has been growing for the last years, and from 2013 to 2017, that the coca cultivation grew 3.7 times. But from 2017 to 2018, that means at the end of the 2018, there was a decrease of 1.3% or something. That's the facts. But in the report, in paragraph 548 and 549, the board calls that reduce that decrease as insignificant. I think the use of the word insignificant here not only is not how to say that, does not correspond with the reality, because we have been having a big increase and now we are decreasing. It's not that much, but if you see the tendency now is totally different. The use of insignificant is not the appropriate one, and that could imply that the board does not understand really the situation in that specific country, and diminish the efforts to get that results. My government had been doing a lot of efforts in order to change the tendency in the growing, and to have this kind of qualifications from one authority that we respect so much is quite difficult, and we do not understand very much why. And you will see, Mr. President, in these days, today, tomorrow, in the journals in Colombia, the notice will be, INCB says that the Colombian reduction of the coca crops is significant. That's something that really worries us. And I would like to know what the reasons that INCB includes that kind of word in the report. The second question, Mr. President, is that there had many paragraphs in the report. I am not going to mention all of these. And in this report and in the report of precursor, in which we find out some errors, some in the figures, some errors. And the question is, and we send a note through the Secretariat showing, highlighting those errors. Are you going to review the presentation of the information, and if you corroborate that there are some errors, are you going to produce any kind of federata or something like that? Thank you very much.
Thank you, Ambassador. And well, first of all, to say that we very much appreciate the efforts of your government over the last many years. Obviously, coca and cocaine has been, one of the top political issues in Colombia for many years, and we all know the great implications it has had on Colombia, on the government, on politics, but also particularly on its people. And we greatly, appreciate the efforts, and we acknowledge the tremendous, also, commitment, but also the dangers that are, that are linked with that. And I think, both the board as well as the international community, appreciates that very much. In terms of the specific word that you were calling at, again, I think it's probably how people may interpret that. I can imagine that from your point of view, the fact that an increase has been changed to a decrease in itself, is significant. I think the insignificant word, or the word insignificant, particularly related to the fact that it was 1%. But I think the fact that the efforts of your government are bearing fruit in terms of decrease are important. I think it's also probably an issue: is that a sustainable decrease, or is it is it a one-off? Is it a matter of weather conditions, or is it a matter of an issue of specific measures that the government has taken? So probably there's some longer term effects to be looked at that as well. In terms of data, let's say the data that we use in the report, in principle, they always come from data that are published by governments, by other UN agencies. As we're all dealing with illicit markets, data may differ. They may not all coincide. They may deal with different periods of time. So I think it's inevitable that there may be differences in the data that we produce and that we indicate in the report, as we of course within our own system that we have in the board in collecting annual statistics from countries, in doing the work on estimates and assessment, we have a consistent process in which we try to do that. We can already see that very often the data that we get from countries, we have questions about that. Are they appropriate? Why are these enormous differences from one year to another? So I think that remains an issue of concern under the dialogue that we have with countries, and particularly also under the INCB e-learning program. We're doing a lot of work with countries to try to improve annual statistics, to try to improve the annual data gathering in that respect, and we will continue to do that. But I cannot guarantee that from now on there will not be questions on data. But rest assured that we do use the data from from the UN system and from national governments to inform our annual report.
Thank you very much. Please, ma'am. I would ask that we stick to questions, please. Thank you very much.
Thank you very much for allowing us member states to also participate in the discussion. And I thank the President, Mr. De Jonge, for your presentation, and to you as well, Mr. Director. Just a very quick statement, because at the outset, I just wish to register that, that the Philippine government has some concerns regarding portions of the INCB report, in particular, those that refer to the Philippine efforts to effectively address the pervasive menace and destructive effects of illegal drugs in my country. As you know, the Philippines' anti-illegal drug strategy is multidimensional and comprehensive. And my government also acknowledges that the problem of illegal drugs needs a holistic and human rights-based approach. I also wish to emphasize that the Philippines has fully complied with its treaty obligations under the 3 international drug control conventions and will continue to do so. And in the process of constructively engaging with the INCB, we are just concerned that the process of treaty compliance monitoring may be politicized. And we are also concerned that the board in its report has commented on issues that may be beyond its mandate and not under its purview. So my question is, how do we, member states, in our constructive engagement with the INCB, be ensured that the board does not allow the process to be politicized and for the board to be able to remain with its mandate? And that said, the Philippines hopes to constructively engage with the INCB and welcomes positive cooperation with a view to enhancing member states' capacity to implement fully the relevant drug conventions, control conventions. So thank you very much.
Thank you very much. We're running out of time. I can see two last questions. So please, why don't we take the 2 questions?
Okay, Robert Lesman from Süddeutsche Zeitung. Just a quick question or remark. I'm following international drug policy since many years, and I was following also the UNGAS process of 2016, when a couple of disappointed countries, let's call them like this, were asking for a new UNGAS process and were looking for a possible change of the conventions. What we saw wasn't a change of the conventions, but explicitly allowance for a broader spectrum of interpretations. I can easily imagine that this doesn't make the work of the board more easy, because it makes it more difficult to draw clear lines, possibly, till which is and which is not in accordance with the conventions. How do you see this concern? Let's take it like this.
Okay, we'd just take the last question over here, and then the President will be able to answer both in one hit. Thank you.
Well, it is just organizational, because we as journalists, we come here, of course, there is a report, and it is a press conference. Some states, of course, they have their own opinion about the report, and I was a witness many years ago. Also, a representative of one country came to the press conference, and he wanted to give a state, and the organizers stopped him. And after he went out, I advised him, because we as journalists, he could prepare a paper, or maybe he could call also for a press conference himself, not, for example, to make this press conference for his statement or to take the time. So this is just, for the next conferences, to avoid But I see that today the organizers, they are so kind also to give possibility to some states, to some countries to say their states. Thank you very much.
Thank you. Just to respond to your question or concern, indeed, I cannot. We're not. How should I say? The world is not getting easier in that respect. I can fully endorse your concern in that respect. Clearly, I think what we are seeing is that there are a number of developments that that are taking place with regard to cannabis, but also with regard to synthetic drugs. That we have called attention to as a board. Again, sometimes the lines are very clear, sometimes the lines are not so clear, and particularly I think the issue of synthetic drugs and the way that is sort of changing, the nature of the drug problem, I think is something that that the state parties will need to address. Next week in the Commission on Narcotic Drugs, as I already indicated, we have presented a series of options, for a better addressing the problem of precursors and pre-precursors, because obviously we can all see that controlling another 20,000 chemical substances is really not going to solve this problem. So I think we do have some very fundamental issues around the conventions that state parties will need to start looking at. And again, we have to recognize that the conventions were drawn up 50 and 60 years ago almost. Next year's we'll have an anniversary in that respect, and I think it is an appropriate time to look at whether those are still fit for purpose, or whether we need new alternative instruments and alternative approaches to deal with these problems. Now, from a state party point of view, negotiations are always complicated, of course. So I'm not sure if countries are lining up to do that, but I think we owe it to the people of the world to ensure that what we agree upon in an international setting is actually effective in dealing with a problem that I think we are all very concerned about, and particularly the way it is spreading and the way it is, it is affecting the world, both in terms of public health, but also in terms of illicit trafficking and all the implications that it has for states and the way it functions. So I think we share that concern. Thank you.
Thank you very much. On that note, I'd like to thank you for coming. I'd like to thank the President and also Barbara for being here. Wish you all the best. Thank you.